Former Chief Medical Officer Dr. Patrick Martin believes the continued state of emergency and restrictions on certain aspects of the economy is not necessary at this time, considering that the Federation was COVID-free for most of the last 2 months. He was speaking recently in an interview on Let's Talk St. Kitts and Nevis on Voice of the Caribbean Radio.
Well, the state of emergency is not necessary. The Public Health Act has all of the necessary measures which are required to detect, contact trace, isolate, and treat persons. Not only a public health matter, but it's an economic, financial, and educational matter for obvious reasons. And so the public policy and the decision makers have to pivot the country to deal with all four concerns: public health, economic, macroeconomic, that is, financial at the level of the individual, and also education, thousands of young persons out of school.
Dr. Martin believes, in light of the COVID-free status the Federation had for several weeks, that the education sector should have begun opening, including other sectors of the economy.
My view is that this approach could have started in early May, but was not started in early May. I think it had to do something with the elections. And so they've now started in mid-June, late June. It is important. It is important to get as much of the domestic economy going as possible so that we can alleviate the pain and suffering on the thousands. We haven't gotten any data as to the number of persons who lost jobs. It has to be in the thousands. I was just looking at something here. We had about 29,000 persons employed as of July 20. That's coming from Social Security data, 29,000. I am guessing that we have lost about 5,000 out of that 29,000, especially from the hospitality, manufacturing sectors and related sectors, so including the self-employed. So quite a number of persons have gone from self-sufficient to now dependent on the government.
The health authorities have always maintained the need to continue the guidelines and phased loosening of the restrictions despite the closed borders and the COVID-free status for several weeks. Chief of Staff at the JNF Hospital, Dr. Cameron Wilkinson, said previously that maintaining the guidelines was necessary.
We have persons who are continually returning home, and so at any point in time the virus can be reintroduced into the population. Just at the last briefing we spoke about New Zealand and the fact that they were COVID-free, and they now have new cases with a couple of persons who came back home to visit their terminally ill patients. And the minister just said that we cannot keep our borders closed forever because we can't stifle the country economically. So at some point in time, we're going to be opening our borders. And so I don't believe that it's anything that we need to shout and celebrate. It's an achievement, yes, but it's just describing the state that we are at this point in time, and it's something that can change. And so we cannot relax the non-pharmaceutical measures that we have been using, and so we need to continue to do our social distancing. We need to continue to wear a mask so that when the virus does come in, we can control the spread and we don't have widespread community spread within our country. Thank you.
Andre Huey, SKN Newsline.